89.9 KMOJ, the People Station, presents Coping with COVID-19. What's up? My name is Zany K, and this special program is KMOJ in partnership with Twin Cities Public Television and TPT Now, Channel 2.5, featuring health, safety, and energy information for and with the cultured communities. You can learn more at tpt.org/tptnow or email tptnow@tpt.org. This special program, we're going to try and take a deep dive into the mental health effects of dealing with COVID-19. My name is Zany K. I'll be your host. Our special guest joining us today, first, Angela Fields.
Hi there, Zany K. I'm Angela Fields. I'm a community health worker at People Incorporated Mental Health Services.
Absolutely. Thank you for being here. We really appreciate it. Also, New York Times best-selling author of My Grandmother's Hands. You probably know this guy. He's been around for a long time. He's actually spent a lot of years here at KMOJ. Please welcome Resmaa Menakem.
Brothers, it's a pleasure to be here with you, and it's a pleasure to come back and speak to the community. So I just, it's an honor to be from this community, and I'm glad I'm here.
Absolutely. Open arms, my brother. Open arms. We got you, man. And so with that said, let's get right into it. Let's kick it off with some facts. I remember we had a discussion. What do we need to know about COVID-19 and the mental effects of it?
Yeah, I think one of the first things that we need to know is that it actually is real, right? A lot of times, especially when things affect our community, sometimes there's information that gets put out there that suggests that it's it might be a conspiracy or it ain't really real. Absolutely. And stuff like that. And I don't think we can do that with this, man. I think with this, we have to take this seriously. This stuff constricts the lungs. It damages the brain. It damages the endocrine system, right? And so we need to understand that the first thing that we need to do is acknowledge that exists and then take precautions, right?
Absolutely.
That some of the precautions are just what people are saying. Wash your hands. Right? Social distance. Put on a mask to protect other people. The mask isn't about, really it has nothing to do with you. It's about how you protect the people that you love and how you protect people in your community.
Absolutely.
And so for me, those are the most salient facts, that it exists and that there's things that we can do to make sure that our children and our loved ones are not put in the hospital dealing with this very serious disease.
One of the things I think people skip over is that, well, if I get sick, it's okay. It's no big deal. It's just flu-like symptoms. But what about that hospital stay?
That's it.
Right? People are not thinking about that hospital stay. That's that's going to come out of your pocket.
Yeah, they're not thinking about the expense, and they're not thinking about what actually happens. If you listen to the stories, and you can actually watch stuff on Google where people who talk about the scarring on the lungs, the fact that they can't breathe, the pain, the headaches, and what they have to do to keep you alive. Like they have to stick that thing down your throat in order to keep your lungs moving.
Absolutely.
That is not a pleasant thing.
Yeah. And so we're just talking about the effects of COVID-19 if you contract it. So do the right thing, practice social distance, practice hygiene vigorously, wash your hands, and wear that mask. A lot of people are having problems with this mask. Getting back to the way that COVID-19 has affected our community and the stress what are some of the warning signs of stress that we should look for in ourselves and those close to us? Are there any exercises we can do mentally to help ward off the stress of everything that's going on?
Yeah, I think one of the things that we need to understand is that this is not an individual stress.
Right.
It is a communal stress, right? Ooh. That's why it feels so heavy. That's why sometimes the routines that we used to use no longer work because we've developed individual routines. And this COVID-19, and one of the things I always say about COVID-19 is that before COVID-19 we had COVID-16-19.
Right.
And so the weathering effects of racism and white body supremacy on our bodies, right, set the tone and set the ground, a fertile ground for the virus of COVID-19 to actually take place. Many of us didn't have adequate access to adequate health care.
Absolutely.
Did not have access to adequate mental health care. So the stress now that is on us from not, maybe for some of us having to work at home with our kids and be in a home with people where we used to could be able to leave, right?
Yeah.
That is a serious matter. There's an adjustment that has to be made, and so that stress level also affects the body, which can exacerbate the COVID-19. So we need to really take this seriously, and some of the things that we can do is start to begin to go for walks, right?
Okay.
Start to begin to figure out what are the new routines for this new kind of weight that we're dealing with right now, and begin to use this as a challenge to maybe address some of the things that we had not addressed, either relationally, personally, historically, and begin to move through this stuff. It doesn't. This stuff doesn't have to be a death sentence to our community or to ourselves, but it does mean we have to readjust.
Absolutely, absolutely. All right. Thanks a lot for joining us again. It's Coping with COVID in 2019. COVID-19. Our distinguished guests are New York Times best-selling author of My Grandmother's Hands, Resmaa Menakem. Angela Fields is also here. Angela, what are some of the... Now, we know that there's a stigma in the black community, right? When it comes to mental health issues, people feel like they're weak, or like, you might look at them like they're crazy if you start to talk about some of your mental issues. In your experience, how are some ways that we can invite individuals to feel okay talking about the stress that they're under?
Well, some people are afraid that they may seem weak or crazy if they talk about their mental health. And some ways that I can invite others to talk about and share their experiences is you may think that showing vulnerability is a sign of weakness, but in fact, it's actually a sign of strength to talk about getting the care that you need. And if we address our own mental health needs, we can better support ourselves, our family, and our community. One takeaway is that it is completely normal to have changes in your mental health, especially during a crisis like a pandemic.
Okay.
So be gentle with yourself and or your family members who are feeling stress, and don't be ashamed to share or ask for help. Actually sharing with others your mental health experiences and inviting others to share with you their mental health experiences will actually reduce and alleviate a lot of the stigmas that is associated to mental health.
Right.
And sometimes we have to just come to the realization that we're not okay, and it's okay to ask for help.
Yeah, and just say, hey, you know what, I'm feeling that way too. I've been there before too. It really helps a person along when they're having difficulty trying to talk about what's going on with them.
Yes.
Absolutely. All right, Resmaa. Now we're talking about individuals who shy away from talking about their mental health issues. But it's important to put things in context. Now, there's a deeper dive as it relates to the trauma that black folks have had to deal with historically in this country. Can you speak to how that trauma is compounded by the recent unrest in this nation on top of COVID-19?
No doubt. Well, I want to actually just piggyback on what my sister said, what Sister Angela just said. The fact of the matter is that some of us may have already be dealing with a pre-existing condition. Conditions like anxiety or depression and other medical pieces, right? Another pre-existing condition is what I said earlier, COVID-19, right? that the things that have affected our community did not get addressed once COVID-19 hit, right? COVID-19 has exacerbated these things with regard to the school to prison pipeline, these things with regard to police brutality, these things with regard to watching black bodies torn asunder, right? The black body in this country has always been seen as where America does its dirt, right? And so what ends up happening is that now we're dealing with a communicable pandemic, as Sis was saying, and that has exacerbated all of the issues with regard to economic prosperity in our community and the disparities, right?
Yeah.
The educational disparities. A lot of parents are concerned now. Where are their children? Black parents, right? Where are their children now going to be in school now that we haven't had school? Some of them were already behind. What's going to happen now? And so COVID-19 has really exacerbated a lot of the fissures that were in this society anyway. And now it's asking us and asking this nation to begin to say, are we going to begin to not just develop a vaccine for COVID-19, but are we going to develop a vaccine for COVID-16-19?
Right.
Are we going to be serious about the things that are affecting these communities and our communities and begin to put things in place that can allow for people to prosper as opposed to just slogging along from the next year to the next year to the next year?
Absolutely. As we stand here today, we're looking at protests that have been happening in Seattle, in Portland for 60 plus days.
Yep.
And this, and people are saying, well, why are they still rioting? Because we need to keep reminding people the window is open now for change.
Right.
If we let it go and everything goes back to the way it was, then none of this mattered at all. You know,
right. The idea to return, like you keep people saying, we just need to get back to normal. Normal wasn't good for my people. Right?
That's right.
One of the things that our ancestor just said, Ancestor John Lewis just said, we need to be causing good trouble. Right?
Yeah.
We need to be causing good trouble, and we need to put these things out and continue the pressure, because ain't no going to change without us demanding that it changes.
Absolutely. So I expect it to continue, and anybody who's real about it, I mean, keep out there, keep doing what you're doing. Programs like this to keep reminding people and bring people together with understanding. That's what I've been saying all along. We just got to get to understanding.
Yeah.
Speaking of that, I'm gonna go back to you, Angela. One of the things that we're kind of missing in this whole thing is you have people like Trump pointing the finger at young people, saying that these are the ones who are carrying the virus because they're not concerned and they're not social distancing. I think what's going over a lot of people's head is the effect that this pandemic has had on the elderly, homeless people. Can you speak to a little bit of that?
Yes, I can, Danny. We are all human, so we're all communicable vices for disease and pathogens. So we pass them off like we do the common cold, flu, and etc. And it's no different with COVID-19. It's a more serious and complex illness.
Yeah.
But how it affects the communities that are the most vulnerable, such as the elderly and the homeless community, they're hit the hardest. Because if we look at them, they're the most vulnerable. They have more complex needs. They have more health issues. And say, for instance, in our elderly, they have age-related conditions.
Yeah.
Their immune system doesn't respond like our normal immune system responds. It's a delay in their response because of the natural aging process. Also, being isolated, being disconnected from services, so to speak, in the homeless community and population, they don't have the privacy and access to bathing and hand washing and other services. What the pandemic did was it highlighted that these disparities are compounded in these communities, and it just showed that there's a lack of access and resources for the general public in the African American community, but especially the homeless and the elderly.
Yeah.
It shows that their chronic diseases and acute diseases, this outbreak is exasperating their health.
Man.
One thing I want to just piggyback on what Sister Angela said is this idea of isolation. We can't forget our brothers and sisters that are in prison, right?
Right.
That it's running rampant. COVID-19 is running rampant, right?
And you can't get out.
And you can't get out.
You can't social distance.
Right. And people are dying in prison from this stuff. And if I made a mistake and I'm paying for my mistake, I shouldn't die.
Yeah.
Right. And so I think one of the things that I've been hearing, like Brother Jason Soul and other people are starting to begin to say is, look, y'all gotta, the plan that you have is inadequate to deal with what's happening in the prisons. You can't just keep moving along like you're moving along and not address COVID-19 in the prisons. Because people are dying. I think one of the things that we have to do, brother, is that we have to begin to think about this less as individual responses as more as a communal response.
Okay.
Right? What are the things that after this is over, what are the things that we need to put in place as a community that can allow us to begin to respond to these types of things, right? So we're not having to wait for the police or other people or the fire department or doctors to do it, that we actually begin to develop and cultivate what we need within our community. Because what we know is right now, since the uprisings happened, what we know is that a lot of those state-sponsored services have slowed down. The police have actually slowed down services to some of our communities.
Okay.
The first responders that actually slowed down services to our community. And so we need to think about what is the opportunity here for us to be able to create a response system that can respond to these types of things before they get to the place of just being of wiping out parts of our community.
Angela, what do you think? What are some of the things that you see that we can do to start this healing process as it relates to dealing with COVID, like Resma said, in the prisons, with the elderly, with the homeless?
My best suggestion is going the communal route. We need each other. And therefore we don't leave one another behind. But also we need more representation for those populations. We need more frontline workers, such as community health workers, because we're community health educators. And due to the pandemic, over half of our profession has been furloughed and closed out. So we are the grassroots. We are the front lines. We are the ones with the closest reach to the community. We have that connection, that community bond. The community trusts us. And the point of our goal is to bridge gaps in systems, such as the health system, the social system, and the community as well. But we're also teachers, so we teach strategies to promote wellness and improved quality of life. We provide, because oftentimes we serve the communities that we actually live in. So we provide that culturally appropriate, person-centered health information to clients about disease prevention and also self-management of their already pre-existing chronic diseases. But we also empower our clients to hold ownership of their health and well-being by teaching them the tools and strategies and skills to obtain the care that they need. And then we also we have an advocate piece, but there's CHWs is so broad in our spectrum of practice that we actually work as links, and we inform community members of resources when they're privy to us. So we work between the systems to have a streamlined system of care. And the best way to address this is knowledge. Look at the risk factors. Go deep within the community.
Absolutely.
Listen to the community, and don't do anything for the community without the community's voice.
Absolutely.
And I also, one quick thing that I think Sister Angela said that I think is also important about what she does and what people like her do is that culturally what they do is that they provide a context. Right, and many times one of the reasons why we don't lean into things that could possibly help us is that we don't understand what the context is. The context seems like something that doesn't apply to us, and when you have somebody who looks like you talking to you in your vocabulary, in your cadence, in the way that you move, right? It creates context. It goes in differently than just somebody who is outside of your community just telling you and trying to give you information. When a black woman can give a black woman information about stuff, right, and say it and do it in ways that give context, Black women and black men take that information, and so I don't want to just blow that piece off, because it's really important in terms of the job that Sister Angela and people like her do, is that they create context. That's why we have to have representation. Absolutely. Right? So I also think that there are locally there are healers. One of the things that we always think about when we're talking about mental health is that we start thinking about a therapist, right? Yeah. And what I'm saying is sometimes I just need to have grandma I just need to lean, right? I just need to have her, I just need to have my daddy hug me, right? And just sit there and talk and go through these pieces. So often there's so much knowledge within our community, and so much healing and black joy that is our community, that we end up forgetting that it actually exists, that is an actual resource for us to tap into. When our own individual resources tap, I can tap into my communal resource, right? Not somebody that's going to necessarily give me all of the answers, but at least let me know I'm human and that I matter, and that seeing me is important, right? And so I don't want to blow over that when I'm talking about healing practices. There are healers in our community, both in our families and within our community, and we have to find those healers in addition to therapy and stuff like that.
Absolutely. All right. Again, it's Coping with COVID-19. Zany K along with Angela Fields and Resma Menachem. You want to learn more, right? I want to point people to resources, get them the help they need and the understanding they need. You can visit the National Alliance of Mental Illness Minnesota. That's NAMI, NAMI.org/coronavirus, or call 800-950-6264, 800-950-6264.
I would say that if you, in terms of the mental health pieces, online there's blacktherapistrock.com. There's always North Point, right?
Angela, were there any resources or any places or that you wanted to share with our listeners?
Yes. Well, I have to first start with my place of employment, and that would be People Incorporated Mental Health Services. It's a certified behavioral health clinic within the Twin Cities area, and we have a diverse team, a multidisciplinary team of providers at many of our locations. So we have 60 locations throughout the Twin Cities. It's over 60 programs, over 100 locations throughout the Twin Cities. We have family services, we have residential services, we have crisis services, we have programs for the homeless, we have community health worker services, we have case management services, we have mental illness and chronic disease treatment, but we also have a training academy, and we have a training institute that allows our organization to expand our reach into the community. So we provide vital behavior health and mental health training within the metro area. Wow. We even have social workers doing ride-alongs in the metro area with police officers to help buffer that gap with mental health calls. And so we have an African American psychiatrist, Dr. Beverly Lewis. She's at our Stark Mental Health Clinic in Minneapolis. She does outpatient mental health services, and we do have other diverse therapists throughout our People Incorporated network. We have our York Mental Health Clinic in St. Paul, and we have various programs throughout the centers to cater to your mental health needs.
Absolutely. All right. Again, on with Angela, who is here with us. Tell me again your agency.
People Incorporated Mental Health Services.
Yep. And we can find you where in the cities?
We are a St. Paul based, just at Mendota Heights in St. Paul, but we have facilities throughout the Twin Cities. So we have 60 programs and over 100 plus programs in the Twin Cities, in Minneapolis, St. Paul, and beyond. So we do have some reach in some rural areas. We do have case management services out there. People Incorporated is a 50-year nonprofit organization, so they have a lot of reach.
Absolutely.
There's a lot of professionals there that could help you at any level of your mental health needs.
And we can tap into that. What's your website again?
It's peopleincorporated.org.
Absolutely. All right. Cool. Thank you, Angela. Also, Resma, we talked about, and I want to get into this just a little bit if you don't mind. New York Times best-selling author, My Grandmother's Hands. Tell me a little bit about the book and, where the concept came from and How proud are you right now, man?
Bro, I'm very proud. I'm proud of us. I'm proud that the book has caught fire.
Yeah.
The book actually came out of a relationship between me and my grandmother.
Yeah.
When I was a community care counselor over in Afghanistan for 2 years.
Okay.
And when I got back in 2013, I was dealing with a lot of my own mental health stuff.
Okay.
A lot of my own trauma stuff, a lot of my own suicidal stuff, and during that time, I had people around me that wouldn't leave me alone and wouldn't let me just isolate. And it was during that time that I actually started beginning to stuff because of the trauma and the kind of the constriction and the difficulty of it. One of the things that happened is that my grandmother kept popping up. And my relationship with her kept popping up. And, she was always a person who was kind of like a rock for us.
Absolutely.
And so one of the things that happened is that the trauma stuff, and the book really is about how trauma gets embedded in the body and how trauma in a person can look like personality.
Okay.
Trauma in a family can look like family traits.
Okay,
and how trauma in a people can look like culture.
Okay.
And so the book really is exploring those types of things, and then what you can really do about it. Like what are the practices that you can begin to put in place to begin to address those pieces. And so I think one of the reasons why the book has sparked so much support in people is that it's actually giving people things to do.
Yeah.
It's not just saying,
not just pointing the finger.
That's right. Not just pointing the finger and saying, hey, you sick. Right? Something wrong with you, right? And one of the things I always say to black people is that nothing is wrong with you. You are not defective. Something happened and continues to happen to you and your people. And so the book allows for you to acknowledge that and puts things into context, and then says, here are some practices that you can both do individually and communally to work through either the historical trauma, the intergenerational trauma, the persistent institutional trauma, or your own personal traumas in gestation, in childhood, in adolescence, and in adulthood.
Absolutely. The book is available right now, My Grandmother's Hands. Best-selling author Resmaa Menakem, also Angela Fields. Thank you so much. We have a few minutes here left. Angela, if anything we missed or left out?
Well, the closing thoughts is how to take care of yourself and physically and mentally right now. My best advice would be limit the news intake. Limit your news intake and get your information from reliable sources. Like the Department of Health has scientists. They employ scientists to look at the facts and look at the current events that are trending in health or with the COVID-19. And the facts that they generate, they allow the governor to make policies for our safety and for our community. Okay. So get your information from reliable sources. Take care of yourself. Eating practices, healthy eating practices is paramount for mental health and physical health, as well as sleeping practices. Limit, your sugary substance, and try to limit, if not partake at all, in any alcohol or drug use, because when you're under stress, that can only exacerbate things and cause other issues. Find some time to spend some time in some self-care, doing some calming activities like taking a walk, or virtually cooking with your friends or your family.
A little meditation.
Meditation. And then it's normal when we're going through a pandemic or a health crisis at this level, or even a civil unrest, that you're going to have changes in your mental health. So take notes of your signs and symptoms. And if gradually over a few days or even a few weeks, if you don't feel yourself, reach out to a professional, whether it be your local clinic or mental health practitioner.
All right. I appreciate you, Angela. Thanks a lot for joining us today. Resmaa, any closing thoughts?
Yeah, just in closing, as Sister Angela just said, your sleeping may be off, your eating may be off, your rhythm may be off. You may have an embodied experience of pressure, like or brain fog. dog right now, you're not crazy.
Okay.
There's nothing wrong with you, but you need, and some of that may not actually be yours. It may be communal. So we need to be with people. We need to understand that something has happened and continues to happen, and that some of your rhythms may be off, right? And so you may actually need to develop different rhythms, right? You may need to develop different sleep routines. You may need to develop different eating routines, right? I used to eat 4 or 5 meals a day. Well, since this stuff has been going on, I'll eat like 2 meals a day.
Yeah.
But I do more snacks throughout the day, right?
Yeah.
It's just a change, right? And so I just want to say that when these changes occur, it doesn't mean that something is defective in you.
Right.
It just means that you're dealing with a lot of stuff, right? In addition to COVID-19, that you now need to develop some other types of skills and readjust. So that's the most important thing for me, is that Black people know we're not defective.
That's right. All right. I appreciate both of you guys, man. Resma, where can we follow you? Give me your social media, everything.
Resma.com, RESMAA.com. I have a free racialized trauma e-course, and people can purchase the book and everything from there. And then, or you can reach me on social media, on Instagram, or Facebook or Twitter. Just come and say hi.
That's what's up. That's the same thing, Angela. I know you gave us your website. You guys have a Facebook page as well?
People Incorporated is on all major social media platforms. Okay. And so they can be reached as well. I also do some work with the CHW Alliance, so in the community, advancing the careers of CHWs, also lobbying for change to grant us access and widen our scope of practice out so we can be more readily utilized. All right. And then also moving forward, if we ever experience a health crisis such as this, that our community health worker profession doesn't get closed off.
Got it. Thank you so much to our distinguished guests, Angela, Resma. Thank you so much for joining us for this special conversation, Coping with COVID-19. KMOJ, in partnership with Twin Cities Public Television and TPT Now, Channel 2.5, featuring health, safety, and energy information for and with cultured communities. You can learn more at tpt.org/tptnow. Email tptnow@tpt.org for all the details. Until next time, it's KMOJ, the People Station.